Hi, I'm Kira and I'll be doing the introduction for my group. So our research question is, are platelet-rich plasma injections, also known as PRP injections, effective in the management of lateral epicondylalgia? Lateral epicondylalgia is more commonly known as tennis elbow and is a common soft tissue injury that results in significant pain in the elbow joint. It affects the extensor muscles of the forearm and is commonly a result of overuse. Other impacts can include pain in the forearm and a weakened grip strength. It commonly affects those aged 35 to 50 who engage in sports that involve gripping equipment or repetitive wrist movements, hence the name tennis elbow. PRP injections are made up of a high platelet concentration of the individual's own blood. This injection is intended to improve the natural healing processes of the individual and thereby repair the affected tendons and decrease the pain. Through the sourcing of various credible journal articles, the effectiveness of such injections in relation to lateral epicondylalgia was investigated. PRP injections were compared alongside other injections and interventions in order to further determine its overall success.
All articles retrieved in order to answer our research question had a clear and concise title and addressed all key concepts included in the article. The abstracts were comprehensible and underlined the article's key objective, with some articles being more elaborate. The abstract in the article by Bergerac-Milos was more succinct and wasn't as detailed as the others. Contrastingly, the article that analysed the relationship between cytokine levels and PRP injections by Lim W. provided a detailed explanation of the growth factors involved and definitions for key terms mentioned. All articles displayed their data in graphs and tables and were descriptive and detailed. However, the graphs included in the article by Bergerac-M were difficult to interpret and lacked overall clarity. The articles by Maria Alessio Mazzola, Qiulong Zhu Jr. and Wenbang Lim proved the effectiveness of PRP injections through comparison to other treatment options, in addition to other testing and analysis. In the articles by Wenbang Lim, the author Lim's previous research underlining the proven benefits of PRP. All articles follow the general structure for a journal article, hence enhancing its credibility. And all patients, except for those in the study by Bergerac-Milos, were screened for eligibility based on their criteria, which ensured the scope for errors was limited. In the article by Bergerac-Milos, the patients with in the article by Bergerac-Milos, the selection process for patients with LE was not stated.
For two of the articles found, the patient's information was reviewed by a researcher who did not participate in the data analysis, hence restricting bias. Between the control group and the experimental group, no significant differences were identified in terms of age, sex, and hand dominance. The sample sizes varied between each article, with some having larger sample sizes and hence enhancing the article's credibility. The article by Wenbang Lim did not state the sample size and no information regarding how the sample sizes was determined. With this, it diminishes its credibility. In addition to it, this article did not have a placebo and could have benefited from this. All articles were written within the last 5 years, ensuring currency. All but one were sourced from Medline, which certifies high quality, peer-reviewed journal articles.
Summarised from the 4 articles sourced, a common link that arose concluded that PRP injections were a more effective treatment plan for those with LE compared to any other form of treatment. 2 of the 4 articles determined within qualitative findings in response to 7 RCTs that patients who received a PRP injection were more satisfied that their level of pain due to LE had been significantly decreased. It was found that within one meta-analysis at a 6-month follow-up post-PRP injection that 515 patients reported to have reduced levels of pain and increased joint function. This was found by patient self-reports in the form of disabilities of the arm, shoulder and hand, more commonly known as a DASH survey, as well as a Rolls-Maudsley RM test. The DASH survey is in the form of 30 questions that patients answer to evaluate their physical function. For example, can you write with no difficulty or are you unable to at all?
Whilst the RM test is a scale of 1 to 4, with 1 being no pain and 4 being a high level of pain, in comparison to the use of corticosteroid injection to treat LE, was also reviewed in 2 of the articles found. However, in support of PRP injections being more effective, it was found that the steroid did provide short-term pain relief, but was not reliable in the long term and could lead to patients recurring their injury. Although these results are characterised by subjective data, the positive improvements recorded supports the idea of PRP injections being effective in managing LE. To support this, with the quantitative findings, one article found that the PRP injections enhance the patient's own healing mechanisms to produce increased amounts of collagen, active cytokines, and the release of high concentrations of platelet-derived growth factors within the body to assist in the healing of the tendon.
Through the use of multiple literature reviews, it was found that PRP injections are the most fitted evidence-based practice to relieve pain in the long term for patients suffering from LE. Although it was found that further research may be required in which to compare PRP injections to other treatments such as corticosteroids, which also deemed a safe option for short-term relief only. These systematic reviews, such as PRP injections, are ideal for patients seeking long-term relief for 6 months or plus. This must be considered by health professionals who need to ensure the treatment is meeting the patient's immediate needs. In this case, we're recommending other interventions to give faster relief, such as corticosteroids, to patients in the short term may be a better treatment solution in some cases. So we like to think of it as a balancing beam. So we have short-term, long-term, and we're weighing out which suits the patient more, taking into consideration their day-to-day life, their needs, their pain perception, as patients who have a low pain perception at the moment may be able to take long-term treatment as it's not bothering them too much and they can wait to see the results like improvement. Whereas an individual who requires lots of movement and like on a 1 to 10 scale is suffering 9 to 10, they may require short-term relief and then can look for long-term after, but they need that immediate pain relief so that they're able to function.